value is a little bit of a worry.
Thank you very much for that big winner. I think this is one of the biggest single-day gains for LIC since its listing. That said, the stock is still much lower than its issue price. Healthcare Global Enterprises is a stock on our radar. It's reported a 20% jump in revenues, but profits have come under pressure. Dr. BS Ajaikumar, Chairman and CEO at Healthcare Global Enterprises, is now joining us on the show. Afternoon, Doctor, and thank you very much for joining in. Your RPOP has risen by 1.5% on a year-on-year basis. RPOP is average revenue per operating bed. Could you tell us, how much of it is on account of high-end surgeries? What's the growth rate expected from here on, and the general demand?
Yeah, our RPOP is for the overall RPOP is including the mature centers and non-mature centers. When you look at some of the RPOP for the mature centers, they are much higher. And some of the centers who are not mature are becoming mature. That is why RPOP is at 39 compared to 36,000. And obviously, we expect this to grow. And one of the things that have happened is when you have more surgeries, obviously the RPOP will come down. As going forward, we expect more radiation, medical oncology numbers followed by surgery. So in view of this, we expect an improvement in the RPOP further.
If you can quantify that for us, it's around 37,000 rupees right now. When you say improvement, you also have new hospitals, Kolkata and Mumbai. What number are you looking at here in that case? Because I do understand Tier 1 has higher RPOP of around 60,000 rupees. Will it go towards, say, the 40,000 mark because of that?
Yeah, definitely. Particularly centers in Bangalore, Mumbai, Calcutta are expected RPOP will go up and Ahmedabad will go up significantly. Bangalore, of course, is reaching a level where the growth may be only 10 to 12%, but others, Mumbai is expected to grow significantly, so is Calcutta.
Again, if you can quantify that for us, it's 1.3% in this quarter. By end of this year, what number are you looking at? If you can give us a broad range.
Yeah, we don't normally give it, but we expect at least 5 to 8% growth, maybe even more as Calcutta and Mumbai pick up. Those are the ones which will add to the RPOP.
Okay. So, we've always asked you about medical tourism. What was the contribution this quarter? And if you could share your thoughts on how it's expected to progress over the next 2 or 3 quarters?
Our medical tourism is going well. For example, our Bangalore center contribution is approximately anywhere between 18 to 20% of the revenue, and it is doing extremely well. So also is our Calcutta center picking up based on the Bangladesh. And where we had some issues for various other reasons was Mumbai, but we are beginning to see that pick up very well in our Kolaba center in South Mumbai. So we expect overall, when you look at the entire HCG revenue, what it is in the 5%, we expect it to grow up to about 7 to 8% in the coming years. Certainly, it is now reaching way ahead of the pre-COVID period.
Okay. So I wanted to speak to you about Milan now, because this time around that saw a decline in revenues both on a YOY and on a quarter-on-quarter basis. What is the outlook here in the first half? What kind of revenues are you tracking in this particular segment or your hospital? And what is the outlook going forward here?
Yeah. We expect Milan to grow about, close to 15 to 18% annually. We also made a submission to the SEBI that we are in talks for a possible merger with Oman. So a combination of these two coming together, Milan being an IVF, Oman being a mother and child, we think will be a powerful combination for way Milan is looking forward. So with this, we expect growth to be significant in the region of about 20%.
Sir, if you can repeat that, I think we couldn't hear that part. When you say talking about merger of Milan with?
No, we announced that we are in discussion for possible merger of Milan with Oman, which is a mother and child. And we will be, if that happens, we expect an additional growth in revenue for both Milan as well as to Oman.
And what is the timeline of this merger that you anticipate?
Yeah, the matter is in discussion. We'll, of course, once the, you know very well how the SHAs and all have to be done. We are in the middle of that. We expect that to happen very shortly, hopefully in this quarter.
So you're also planning some cost optimization initiatives as advised by your partner at consulting, which will help drive a margin improvement of 100 to 150 basis points in FY24. Is that correct? Could you give us an indication of where you are looking to bring down costs, and what else? What else has been the advised by the consulting firm?
Yeah, we are taking two fronts. One is in the cost optimization. We are in this looking at possible improvement in the margin, as you said, 100 to 150 basis point. Not only that, long term, this will add definite benefit for us in terms of operational excellence. So things are in the middle. We expect this to be completed by end of the last quarter.
Okay.
Apart from that, we are also working with another group on the digitization. Digital health now is becoming big, and we are taking very active role. We have invested significantly in this. And I think this will also start adding value when you look at the number of hits we are getting, number of things, what we are becoming well known. I think this will also give us the fruit in the last quarter of this year.
Okay.
So by beginning of next year, all of this would have given us the additive value.
All right. So that is the outlook as far as margins and cost-saving initiatives are concerned. Last question before we let you go. In 2 to 3 years, with a lot of these new hospitals, your new hospitals reaching the break-even point, and a lot more that is happening in your company, what is the occupancy that you are planning? Will it be around that 80% mark, or you can do better than that?
No, in oncology, 80% is not achievable because a lot of it is outpatient therapy. It is not like a multi-speciality hospital. We'll be very satisfied to reach around 70%. Right now, we are about 65% or so. We expect overall, as the new centers also grow up, 70% is nearly completed as near full occupancy.
Okay. All right, sir, Mr. Kumar, thanks a lot for joining us and taking us through what the plans are. So that's the word coming in from Healthcare Global. The stock is up 1.5%, and decent commentary coming in from